welcome. My name is Miriam, and this sequence we are doing today enhances the health of your lower back and your spine. So we will work on extension of the spine to create space between our vertebra and to take the pressure of the spinal discs. And we will also do some releasing for our hips. So all four sides of our hips and legs, here the front, the hip flexor, the quads, also through the inner lines of the legs and the groins, and also through the outer lines of the legs, IT band and glute and the hamstrings, and to take the pressure off the lower back and to increase the mobility in the pelvis. For today's practice, you need one yoga block. If you don't have a yoga block, you also can take a book, like roughly the same size, that works as well. One small towel and one blanket. And we'll start right away. So what you do now, you take your right leg here in front of you. And you take the left leg behind you, so both legs are in a 90-degree angle. If you find this is uncomfortable here on your foot, you could take the blanket, so you just open it and you just place it here underneath your leg. So from here you keep the angle here in your legs, and we want to fold forward towards our foot, and the target area will be here, the outer right hip, our glute area. So from here you start to fold forward, and you can interlace the fingers here around your foot, and you pull your heart forward towards here your right foot. Now you also can play around a little bit with the angle. If this is too difficult, too much for you, you could bring heel and knee closer towards each other. If you are more receptive and your bone structure allow you, you can also widen the angle, bring heel and knee further apart from each other. And then from here, you fold forward over your leg until you feel a stretch here on the outer side of your right leg. Keep your shoulders relaxed. We'll be here for about a minute. So this is active stretching, what we are doing, not a yin practice today. So you want to keep the muscles engaged, so flex your foot, and we want to feel the stretch in the belly of the muscle. Lower back and hips are always connected. When you have tension in your lower back, then you need to release all around the pelvis as well. Now we also will incorporate a twist and side bend in our short little sequence to take pressure off the spine and to also improve the mobility of our spine. With every exhale, maybe fold a little bit deeper. Send your breath into your outrighter hip. Now from here you come up and you keep the legs exactly as they are, so don't change the position of your legs. We're coming into a twist. As you turn your body all the way over here now towards the right side. Step one, be here with your hands on the floor and just see how it feels on your lower back. For some people, this is already enough. You want to be gentle with this one because it can be quite a deep twist. So option one, you're staying here today, you just work on lifting the chest and squaring the shoulders. So make sure you're not sinking here into your shoulders, press the floor away from you and square your chest here towards the right side. If you can go a little bit deeper, maybe you take your forearms here on the ground. Same thing, try to level your shoulders to deepen the twist. So you will feel that somewhere here in your lumbar area. Keep your spine long. And if you're even more receptive and it's okay for your spine and your lower back, maybe you want to come all the way down towards the floor. And you also can use your block here as a little support if you need to, maybe underneath your chest or underneath your forehead. And if you want and can go even deeper, you can take here your right hand onto the ground. So the forearm here of your left arm stays on the ground, and we deepen the twist as we are pushing here with the right hand into the ground to open even more here towards the right side. And you also can take the hand a little bit away from you and straighten the arm, or you keep the elbow bent, whatever feels comfortable. But if this is too much, just stay here. Find your workable edge. You don't want to strain your body too much. We just want to release tension from the lower back. And then slowly find your way back up. And then we do both postures on the other side. So this time take your left leg to the front. If you need to, you take the blanket underneath. Both legs are in a 90-degree angle. Again, if it's too much, you bring here heel and knee closer towards each other. If you're more receptive, you can open a little bit wider, okay? And then we start with our forward fold. So you fold forward here in direction of your foot. You catch your foot, so you have something to hold on, and you pull yourself forward until you feel the stretch here in your outer left hip, in your gluteal area. Stay with a deep, smooth and calm breath. Releasing all this tension, build up tightness here in our outer hip. Deep inhales, long exhales. Just a few more breaths here. And slowly you find your way back up. You don't change your legs, and you just turn around all the way towards the left side this time. Start on your hands and try to level your shoulders here towards the left side. So feel the twist here in your spine. So you're isolating, trying to isolate the pelvis and the spine. So your pelvis is not really moving, it's just your spine. If you can go deeper, you come down onto your forearms. So this side might feel different. Now we are not symmetrical. And especially if you have a scoliosis, you might feel quite different from right to left side when you do twists or side bends. Again, make sure you're not sinking too much here into your left shoulder. Press both forearms into the ground and keep your shoulders level. If you can go deeper, maybe you rest the forehead on the ground. You can use your block in any way to support you here. And for those who are looking for a deeper release, taking here left hand onto the ground and push the floor away from you to twist more open here. Towards the wall behind you. Now listen to your body and see what works for you. There's no need to force yourself into any shapes. Okay, and then slowly find your way back up. And from here you bring your back leg to the front. And then you open your blanket. So you have some protection underneath your knees. Coming onto all fours. Let's mobilize our spine a little bit. Yeah, very simple exercise, cat and cow, but very effective. Hands shoulder width apart, the fingers are spread wide, knees hip width apart, hips above the knees, shoulders above the wrist. And then with an inhale, you lift your chest, you arch your spine, shoulders away from the ears. And then exhale, you pull your chin towards the chest, round your spine. Now keep pushing the floor away, lift through your armpits, broaden your upper back and release the tension here along the spine. And then again, inhale. We are arching the spine. And exhale, pulling the navel back towards the spine. We are rounding the spine. Again, inhale. You lift your chest, looking forward. Allow the belly to release. And again, exhale, push the floor away. Lift through your armpits, broaden through your upper back, shoulders away from the ears, tucking the tailbone. Again, inhale. Move with your breath and feel your way through the movement. Exhale. Last one, inhale. And exhale. Good. From here, you open your knees a little bit wider than mat width. You bring your big toes to touch and you press your glutes back towards your heels and you grab your block. So in this pose here, we want to release tension through the inner thighs and the groin, so you need to separate your knees. And we want to extend the spine as we press our hips back, and we are using the block here to push away from us. Yeah? So it's a very active pose. You take the thumb here on the front edge of the block, the fingers on top, and now you start to slide, 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 push away the block away from you. So the elbows are not resting on the floor, your arms are lifted. Now roll your outer armpits down towards the ground. Keep pushing the block away from you. Keep pushing your pelvis back. Imagine someone is putting their hands on your lower back, your sacrum, and is pushing you gently down and back. At the same time, someone is holding your hands and is pulling you forward, so away. You're reaching in two directions, fingers forward, pelvis back. With every exhale, you allow the heart to soften closer towards the floor. Allow the muscles on the middle back to soften. And if you're quite stiff in your shoulders, you might feel that there as well. As you breathe in, feel the breath filling your back, your upper back, your middle back, your lower back. And as you exhale, just feel the hips heavy and extend maybe a little bit more. Just for another 5. Keep gazing to the block if okay for your neck. 4. Create a space between your vertebrae. 3, 2, and 1. Very good. Come on to your forearms. And then from here, take the fingertips to the ground. Carefully bring the knees back. From here you come up onto your knees and we will need one block. We will come into a side extension. So just having some padding here underneath the knees. So knees are hip width apart. You take your block high setting to begin with. So what we want to do here is we're going into a lateral flexion, into side extension for the spine. which is really good to release tension here from the lower back. The quadratus lumborum, here's a big muscle, the QL on the right and the left side of the lumbar spine. So you will feel the stretch here on the side here, and also a little bit here maybe on the lower back area, okay, on one side, and then we also will do the other side. Important is when we come into the side bend that you're not arching your spine or not overarching your spine to create pressure on the lower back, because then you might feel a pinching sensation. So you need to reach the tailbone down, and we're just moving sideways. Imagine you just move between two glass walls. You're not leaning forward, not leaning backward, okay? So from here, start with your left hand on your sacrum and feel your tailbone and your sacrum, and now reach your tailbone down and move your pubic bone here up towards your navel. So the hips are not going back, they're going forward. Yeah, so you're tucking your tailbone a little bit. You feel a slight squeeze in your hip. Keep this contraction all the time. Yeah, you can keep the back toes tucked under, or you relax top of the foot on the ground, whatever feels more comfortable to you. Now from here you start to bend to the side, just to the side, and take the hand here to the block. So if you feel this is very easy for you and your elbow starts to bend and you have a lot of weight on the block, then change the height setting of the block. It's not important how far you go, okay? It's not important at all. So once you feel here this pulling sensation, this traction on the side of the hip, that's when you maybe reach the arm here over your head as well. So don't take too much weight onto your hand. So the hand is just resting lightly here on the block. Now bring your bicep closer towards your face and reach out through your fingertips. So try to straighten your arm as much as you can, and your chest is lifting towards the sky. Squeeze a little bit through your hip, tailbone reaching down. Breathe here into the left side of your body. Keep the shoulders relaxed. You can look up into here, your elbow creased, or you look to the front or down to the floor if it's uncomfortable for your neck to look up. Let's be here for another 5. Move your hips a little bit towards the left side. 4, tailbone reaching down. Keep the chest open. 3, 2, 1. Now we're coming carefully out, slowly bringing the hand back towards the lower back and sacrum. Inhale, coming up. Now take the block to the other side. Wonderful. Side bends are great to decompress the spine, especially if you have scoliosis. I find this very, very helpful because often there's a lot of compression on one side of the body. So again, tailbone reaching down, you move your hips slightly forward, pubic bone up towards the navel, then you start to bend to the side. This time we're taking our right hand on the lower back. You can start here, high setting or low setting. Again, make sure you're just bending to the side. And then once you feel here the pulling sensation, you start to reach your arm over your head. Palm is facing down. Move your hips to the right, just a little bit, and slightly forward. Keep pulling the navel in and up. Bicep closer towards your face. Reach out through your fingers. Yeah, when we are working with the spine and want to release tension from the lower back and improving the mobility of the spine, we need to move our spine in different directions, and 6 different directions. Yeah, as we're bending forward, flexion, extension when we are bending the spine backward, and then also twisting to the right and to the left side, and also what we're doing now, lateral flexion to the right and the left side. Stay here another 5. Keep the tailbone reaching down. 4, reach out through your fingers. Keep on breathing. 3, 2, and 1. Carefully take the hand first on your lower back, come up. Good. So from here we stay on our knees. I just face sideways to you so you can see me a little bit better. So now have again your knees here on the blanket, and then you take your right foot here front. Keep your back toes tucked under. That gives you a little bit more stability. So what we want to do now, we released already a little bit of tension through the inner line of the legs and the groins, and also through the outer lines. Now we want to release tension here on the front of the hip, on the psoas muscle, the hip flexor. And the psoas is here connected from your thigh bone to the lumbar spine. So you can imagine if this muscle is quite short, it starts to pull on your lumbar spine and is compressing your spine. So have here the knee above the ankle. So what you do now is you focus here on your pelvis. So you're scooping your tail like a dog is scooping its tail in. So tailbone reaching down, and again same action, pubic bone moving in and up. And if you do that correctly, you already should feel a good stretch here on your hip flexor, here on the front of the left hip. So now from here, keep maybe your hand here on your sacrum to remind you that the sacrum is reaching down, and then lift your left arm up. So the fingertips reaching up, and then you slightly, just a little bit, lean over towards the right side and a little bit backwards to create even more opening here through the front of the hip. Now you also can take your hand here to your thigh. Reach a little bit more over towards the right side. So it's a slight side bend, and keep reaching the tailbone down. Last 3, 2, and 1. Exhale. Slowly coming down. Good. Take your right leg back. Left leg forward. Same on the other side. So hand on the sacrum. Reach the tailbone down. So you need to move your hips forward. Pull the navel in and up. So you're sipping up your lower belly. Just see how that feels here on your quadricep and also on the hip flexor. And then you lift the arm. So now you just come into slight side bend, leaning over towards the left side. Really reach out through your fingers. Try to extend the arm as much as you can. Move your hips slightly forward, tailbone down. Keep your chest lifted. Keep on breathing, avoid holding your breath. Last 3, 2, and 1. Exhale. Bring it down. Good. Now come down onto your knees, and we will lie all the way down on our back. Now you take your folded blanket and you place it here underneath your pelvis. So from here we stretch the hamstring, the back of the leg. So this is a very simple stretch, Supta Parangustasana, call it in yoga, to release the hamstring and also the lower back. And it's quite good as you lie on your back, there will be no strain on your lower back, instead of when you're standing falling forward and try to touch your toes, which can put a lot of strain on your lower back if your hamstrings are tight. So you extend your right leg up towards the ceiling. Take here the towel around the ball of your foot. And then from here you pull the toes towards you and reach the heel up towards the sky. So keep your sacrum pressing down onto the blanket. Move your right hip down and away from your right shoulder. And if you can, move the leg or pull the leg closer towards you, but keep the knee open. You want to open the back of the knee. You keep lifting the kneecap up, thigh muscle is engaged. You even could push a little bit the thigh away from you with your hand if that helps you. If you're very receptive and flexible, of course you can straighten your leg, but it's a bit easier if the foot is on the ground. Keep your elbows, your shoulders relaxed. Release all the tension here from your sit bones up towards the heel. Staying here for 5 more deep breaths. release, and then you take the other leg up towards the sky. Open the back of the knee, press the sacrum down. Move your left hip slightly down. And then slowly release. From here, we take the block, and you just place the block here underneath your sacrum. And from here, you stretch your legs out, just a gentle opening through the front of the hips, and you open your arms here, mat width apart. You open your legs mat width apart like a starfish. Anytime, if you feel it's too much for the lower back, you feel some compression, then just bend the knees. Just be here for a few breaths. Just trust the weight of your pelvis down into the block. Close your eyes. Allow your mind to calm down. Just relax. One more deep breath. And exhale, take your arms down, rebend your knees. Take the pelvis on the ground, hug your knees in, just rock a bit from side to side, massage your lower back and your sacrum. Inhale, bring forehead towards the knees, round your spine. And then slowly, carefully roll to one side and come back up to sitting. Thanks for joining me today. I hope your lower back feels a little bit better now and there's not so much tension. So try to do that like from time to time, especially if you sit long hours, to take the pressure from the lower back. Thank you.